Hello again, everyone. My name is Marty Guthmuller. I am CEO of Orange City Area Health System. Today is October 30th, day before Halloween, and I'm bringing you today the 68th version or edition of the COVID-19 community briefing. Again, as I periodically mention, all of my data is coming from the coronavirus.iowa.gov website, and so you're free to double check, triple check all the information I have, and probably more importantly, follow along at your own pace or dig into things at your own depth on the coronavirus.iowa.gov website. So this is a Friday edition, so we'll start right in with the Sioux County information. And generally speaking, the numbers are going to be higher throughout the state. We'll talk a lot more about that as we go through these numbers, but the general theme is things are heating up again. So Sioux County, 2,575 positives of the 9,814 tested. That is a positivity rate of 26.2%. Again, that's a high number. We've had 148 new positives since Monday. Just yesterday, as an example, we did 68 tests, we being Sioux County. At least that's when they were reported. 29 of those 68 were positive. That's a 42.6% rate, nearly half. And so there's no reason to doubt why or how our collective number in the county is going up. When you have a day like yesterday, 29 out of 68, nearly 50% positive, 42.6, that gives you an indication of the positives that are out there. We'll talk more about the acuity factor of those positives. Again, as we've talked all throughout this, one of the issues we need to watch are positivity. How many people are getting and are documented with the virus. The second issue, and perhaps the most important issue, is how sick are people getting? What's the acuity of these positives? How is that virus manifesting in the utilization of resources, primarily from the health sector? Not just PPE, but beds and wear and tear on staff and that kind of thing. So we'll talk about that a little bit later as we go through. Moving from Sioux County numbers to the 14-day average number in Sioux County, again, our numbers are going up. We went up from 19.8% 14-day average to 20.4%, but we did drop in the state from number 7 to number 8. Small consolation. That means a number of other people went up higher, but we did go up from 19.8 to 20.4. O'Brien County, our neighbor to the east, is now number 1 in the state at 23.2%. So they jumped 3 percentage points. They were previously at 20.1. Plymouth County is number 7 in the state. They are at 20.7%, and that has not changed since Monday. Lyon County, again, a shallow victory here. They're at number 14 in the state, but actually did go up in their positivity rate from 16.9 to 17.5. So that's the 14-day average numbers in the 4-county area that we typically look at up here in the northwest corner, and that is, they're all up. Probably more concerning to me is, and this is an arbitrary categorization that I've made simply to try to keep the pulse on what's going on around the state. But I always report on the number of counties in the state at 10% positivity rate or higher in the 14-day average. Again, I picked 10% just because it's double digits. And when the state looks at it, they categorize 15% and higher as more in the alert zone. but I looked at 10 to get a little broader perspective. On October 19, that number was 44. And by that number, I mean there were 44 counties in the state of Iowa at a 10% 14-day average rate or higher, 44. The next briefing we did, that number was 50. The next briefing that we did, which was last Monday, was 65. Today, that number is 78. So I could only count 21 counties in the state that were below 10%. So there were 78 counties at 10% or higher, significantly up from just 10 days ago at 44. So that is concerning in terms of the positivity rate, and we're going to talk about acuity as well. And a little bit of a spoiler alert, we're concerned about the acuity level beginning to go up as well. Again, we'll talk about that shortly. Moving to Region 3, which has been our norm. Region 3 is the 20 counties in Northwest Iowa. We have 124 hospitalizations in Region 3. That is up from 112. We do have 20 patients in the ICU. That number is steady, and it was 20 on Monday as well. 11 patients have been admitted in the 20 counties in the last 24 hours. Of the people in the ICU, the 20 patients in the ICU, 8 of those people are on vents. Sioux City, as an example, yesterday had a census, a COVID census of 72, which they've been in that 70 range for a couple weeks for sure. And they do have 20 people in the ICU. So the timing of these stats aren't always the same, but right now, what I reported just a moment ago about Region 3 being 20 ICU patients, apparently they're all in Woodbury County. They're all in Sioux City. But again, that could vary by a day here or there. In Iowa, stepping back and looking at the entire state, we have 124,358 positives of the 963,686 tested. That is a positivity rate of 12.9%. That is up from 12.4. So we've had a 0.5 percentage point gain this week from Monday to Friday over that population of 963,000. So there's been a significant uptick in the number of positives. From 12.4 a week ago, we were at 12.2, and today we're at 12.9. The next metric that we look at is hospitalizations in the state. Continuing with the theme, it is up. Today, the coronavirus.iowa.gov website lists 564 people hospitalized in the state of Iowa. That number on Monday was 499. So we've had 65 additional folks hospitalized in the aggregate since Monday. The number a week ago was 482. So 482, 499, and today 564. Breaking that down in the counties, Sioux County stays at 10. We've been pretty steady in that area. It's been a little calmer in our hospital, typically in Orange City, typically anywhere from 3 to 6 is where we've been in the last week here at the hospital. So we've had 10 patients out of those 564, or 10 Sioux County residents have been hospitalized as of today's coronavirus.iowa.gov website. O'Brien County has 4 residents hospitalized in the state of Iowa. Plymouth County 7, Lyon County 1. So those numbers, Lyon, Sioux, O'Brien, Plymouth, in terms of residents being hospitalized, really are fairly steady and are not representative of the increase in the number of hospitalizations in Iowa as a whole. Fairly steady in our 4-county region. with the exception of Woodbury County. Woodbury County is 48, and I'll check that number previously. We were at 36 on Monday, so they've gone from 36 on Monday to 48 today. Again, that's Woodbury County residents hospitalized. When you look at the Sioux City hospitals, they have a total population as of yesterday of 72 hospitalized with COVID. Polk County has 57 residents of Polk County, the Des Moines area, hospitalized. They are number one, and I'm checking the previous. They were at 43, number one and 43 on Monday. Today they're number one at 57. So they've had a pretty significant increase this week as well. We've also had a number of additional deaths, 69 additional deaths since Monday. That number is now 1,705. For the first time in a long time, there's been a change in the demographic. And by a long time, I'm saying several months. That we are now at 90%. It was 89, so not a big difference, but it did change. 90% of the deaths in Iowa are 61 and over. So the demographic has not changed up to age 60, but 61 and over has actually increased by 1%. By the way, the 80, the 61 and over group is broken down into two categories, 61 to 80, and that number is 40%, and then 80 plus, and that number is 50%. So when you combine the two, the 40 and the 50, you get the 90% at 61 and over. But the lion's share of those are 80 and over, and that's why nursing homes are something we have to really be careful of and be very vigilant about. I mentioned a little bit about acuity. Here locally, our acuity is being pretty consistent, and we're being taxed heavier than we have been in terms of the use of resources, wear and tear on staff, that kind of thing. And that's all about what flattening the curve was about, right? So let's not try to flood the health system collectively with a number of patients. Again, not trying to indicate that people aren't going to be tested positive, not indicate that people aren't going to get sick, but let's spread this out a little bit so that we don't exceed our capacity to help people. Because by and large, we are able to help people with the new therapeutics and treatments, that kind of thing. What is happening is going to require additional vigilance on our behalf. This is clearly not over. And you know, you don't want to be too alarming, but you do want to be prudent with your approach. I visited with a CEO at a Davenport health system earlier this week. They are experiencing a rather significant increase in the acuity level. Their positivity rate isn't, in fact, it's a little bit lower than ours, but their acuity level is higher. And people are getting sick and requiring significant downstream services. Their death rate hasn't been impacted much, but the burden on providing the services has been and will likely be tested even more. So there is some concern out there, and when you look at where all of the growth in the positivity is coming from in Iowa, it is typically central and eastern right now. And so we'll see if that migrates east to west or not, but we do need to remain our vigilance here. And this is repeating the record. This is the 68th edition, and so it's a number of times I've said this. Masking is important, but you need to understand that wearing a mask, while it is important and you need to do that, does not make you bulletproof. And so the problem with sometimes people wearing masks is they violate some of the other social distancing thing and still do the group things. And masks do not make you bulletproof, but please wear your mask. It is a level of defense that we need to employ. There's no question about that. We need to do that. Wear your mask. But don't forget the other things in concert with mask wearing, and that is social distancing, avoiding large gatherings, those kinds of things. The other thing that we've talked about, again, repeatedly, is proper hand hygiene. Wash your hands frequently. I think they say 20 to 30 seconds, and use the hand disinfectant as well. So those are the things, nothing new there at all. And still enjoy your weekend, enjoy life, get out there. But I think we need to be continued in our resolve to fight this thing. It's being what I refer to as the collective burden of COVID is manifesting itself in many, many different ways. We simply need to be aware of that and do what we can to avoid that. So we'll get through this. Things are going well locally here at the health system. We appreciate all the cards and notes and well wishes and encouragement that we've received. And we thank you for your loyal support as well. So I'll close now by saying, remember to stay strong, stay vigilant, and above all else, stay healthy. I anticipate the 69th edition of this briefing to be on Monday. And so have a great weekend. And we'll see you on Monday again if this is of interest to you. So thanks again. Have a great weekend.